Hello, myself Yaspaktaria. Today I am going to explain a topic from subject medicine, the pathogenesis of the type 1 diabetes mellitus. First of all, the definition: the type 1 diabetes mellitus is a chronic autoimmune disorder in which the body immune system destroys the insulin producing beta cells of the pancreas, resulting in absolute insulin deficiency and persistent hyperglycemia. This is the flow chart of the pathology of the diabetes 1 type 1. Genetic susceptibility plus environmental trigger, autoimmune response, T cells mediated beta cells destruction leads to the insulitis, progress leads to then it leads to the progressive loss of the beta cells, absolute insulin deficiency. Then hyperglycemia plus lipolysis causes the ketone body formation and diabetic ketoacidosis. Then, first is the genetic predisposition. The development of the type 1 diabetes mellitus began with the genetic susceptibility. Important gene HLA DR3, HLA DR4, HLA DQ2, HLA DQ2 and 8. The genes regulate the immune response and increase the risk of developing autoimmune reaction against the pancreatic beta cells. Significance: having this gene does not guarantee the diabetes. They make the individual more susceptible to environmental and trigger the initial autoimmunity. The environmental triggers: genetical susceptibility environment factor may trigger the autoimmune process, such as the possible triggers are first the viral infection, Coxa B beta virus, rubella virus, cytomegalovirus, mumps virus, dietary factors, environmental toxins, early life and mechanism. Some viral protein resemble the beta protein, molecular mimicry, the immune system attack. The next is the initiation of the autoimmune response. The immune system begins recognizing the beta cells as the foreign agent. The role of antigen presenting cells, APCs, the macrophages and the dendritic cells captures the beta cell antigen. These antigen are presented to the T lymphocytes in the lymph nodes. The activation of the T cells, CD4 plus helper T cells become activated. CD8 plus cytotoxic T cells are stimulated. Inflammatory cytokines are released, and the examples are interleukin 1, tumor necrosis factor alpha, interferon gamma. And the fourth is the formation of the autoantibodies. As the autoimmune process progresses, the antibody against the beta cells component appear in the blood. The major autoantibodies, like first is the isolate cells antibodies, insulin autoantibodies, anti-GAD antibody, IA2 antibodies, zinc transport 8 antibodies. And the clinical importance of these antibiotics are the markers of the disease. They may present a year before the symptoms develop. T cells causes the most of the beta cells destructions. Fifth one is the progressive beta cells destruction, called insulitis. Insulitis refers to the inflammatory infiltration of the pancreatic isolates by the immune cells. The cells involve CD8 plus T cell, CD4 plus T cells, macrophages, beta lymphocytes. Results: gradual destruction of beta cells, progressive reduction in the insulin production. Symptoms usually appear when the approximately 80 to 90%. The sixth is the absolute insulin deficiency. After the extensive beta cells destruction, the insulin production becomes extremely low or absent. The body cannot utilize the glucose effectively. The normal function of the insulin, as we know, the insulin promotes the glucose uptake by muscles and adipose tissues, glycogen synthesis, fat storage, protein synthesis. Without insulin, these functions fail. And the seventh is the development of the hyperglycemia. The mechanism behind this, the first A is the reduced glucose uptake. Muscles and the fat cell cannot absorb the glucose effectively. The blood glucose level rise. B, the increased hepatic glucose production. The liver continues the glycogenesis, means the breakdown of the glycogen. Gluconeogenesis means the formation of new glucose. This further increase the blood glucose, and the consequences will be the hyperglycemia. And the eighth it will be the polyuria, polydipsia, and polyphagia. What is polyuria? The excessive glucose in the excreted in urine, pulling the water with it, result in the increased urination. And polydipsia means the fluid loss cause the dehydration, result in the excessive thirst. And polydipsia, cells are unable to utilize the glucose. Ninth is the fat metabolic and the ketogenesis. Because the cells cannot use the glucose effectively, the body switches to the fat as an energy source. The triglycerides are broken down, the free fatty acid enter the bloodstream, the ketone body formation. The liver converts the free fatty acids into the acetoacetate. The beta hydroxy butyrate acetone, these are called ketone bodies. The 10th and the last stage is the diabetic ketoacidosis. The excessive ketoacidosis ketone production causes the metabolic acidosis. The feature hyperglycemia, ketonemia, ketonuria, metabolic acidosis. The clinical signs, as we can see in the patient, the nausea and vomiting, abdominal pain, dehydration, the Kushmal breathing, fruity breath odor. 11 is the protein catabolism. Without the insulin, the protein synthesis decreases, the muscle proteins are broken down. The consequences in the patient, the weight loss, the muscle wasting, and the weakness. This is the summary of the pathophysiology of the diabetes mellitus. Thank you.